Hi, my name is Twinkle Mehta, and I go to Emory University School of Medicine in Atlanta. I'm from Nashville, Tennessee originally, and I went to undergrad here at Emory. The primary application process is not super fun, but it's necessary, and so I applied to a lot of schools, and there were a lot of essays, but I think it's very important to put a lot of time both into your personal statement. I mean, personal statement is very, very, very important, and it really does force you to really question why you want to go into this profession. I think I had like 15 drafts of my personal statement, which, I mean, I don't know if that's normal or not, but you know, I think it's something that you should put a lot of work into because I think it's meaningful. And it shows, you know, schools why you would be a good candidate, and I think it tells a lot about you, and definitely have lots of people look over it, edit it. I know it can be a little strange at times to have so many people critique your writing. I know I get a little, not necessarily offended, but like it is hard to have so many people critiquing one piece of writing that you did, and everyone has different opinions. But definitely get a lot of feedback, because the way that something sounds in your head may not be the same as it sounds in, you know, when someone else is reading it. And definitely put a lot of time into your secondary essays as well, because I think they matter a lot to medical schools. And I think the secondary essays are a really good opportunity to show the school that you're applying to why you want to go to that school in particular, and not just medical school in general. So if this is a school that you're really interested in, you know, like find out what makes them tick. Maybe like if you know a student there, email them, ask. Because I think they can be really great resources as well, because they know the school, they're there. And yeah, I think those are the biggest pieces of advice for the primary and secondary applications. I would also say try to get them in as soon as possible, because you're really just playing a numbers game. The earlier that you get your applications in, the smaller the pool is for them to compare it against. So ideally, you would get your application, your primary application, in maybe a week or two after they've released it. I wouldn't wait like a month or two, because then you're just competing with more people. And same with the secondary applications. Like as soon as you get them, I mean, I know it can be hard, especially if you want to make them good, but I think that that's important. Especially if there's a school that you are really interested in going to, then make sure you get that application in as soon as you can. So interviews, at least for me, were the most fun part of the process. Also stressful, definitely stressful, but I think it beats writing essays for X number of hours a day. So, okay, so advice for interviews in terms of attire. Definitely wear a suit, look presentable, you know, brush your hair, and I wore glasses to all of my interviews to kind of, you know, give the feeling of, you know, she knows what she's doing. I would not recommend wearing heels because you tend to do a lot of walking on your tours. Obviously this does not apply to men. I mean, maybe it does, maybe it doesn't, but mainly girls. I would probably stick to flats, and just be confident during your interviews. What to do in preparation for them is, so a few days before my interviews, I would kind of go through some of the questions that I think might come up during an interview, and I would just write like bullet points. So basically just talking points of what I might talk about. And so I did that a few days before the interview, and then maybe, you know, that same day, do some research on the school, figure out what their mission statement is, and who the dean is and what their school is really about, and make sure that you have 2 or 3 questions to just ask your interviewer at the end of the interview, because most of the time they give you the opportunity to do that. And I think asking a well-formulated, well-thought-out question kind of indicates to them that you are actually interested in the school and you did your research. And yeah, so the night before my interview, I would just kind of go through the talking points so that when I got to the interview, I wouldn't just like blank out and freeze, because I was always afraid of that. But yeah, I wouldn't, they can be very stressful, they are stressful, but I think it helps to just be outgoing, or outgoing as you can be. Don't, force yourself to be anything that you're not, but definitely be more outgoing than you normally are. And, introduce yourself to your fellow interviewees, introduce yourself to your interviewers, and really just, walk with confidence. And I think most schools, I've never actually done like the multiple mini interviews, but I think a lot of schools do, and that I think are becoming more common now. But there are schools that will kind of, put you in a room with like a standardized patient and just kind of see how you interact with them in that situation. And the point of that is not to test your medical knowledge or anything. It's just kind of to see how you interact with the patient and to make sure that you're not like a psychopath. So I would not worry about that. But yeah, I think just my biggest piece of advice is definitely do your research on the school, and have questions prepared, and get there early, because 1, that's less stressful and you won't be like running in the door. And I think it is professional to be prompt. I think if you are on time, you're late. If you are 10 minutes early, you're on time. If you took that to another extreme, some interviews I was an hour early, not really sure why I did that. Seems a little unnecessary. But yeah, definitely get there like 10 minutes early, just, because I think it's professional and it's nice and it's courteous. Yeah, I think that's all the advice I have for that.